It's a really terrific session today, and I think such an important one. Thrilled to be here as always with Ryan and Nathan and Elisa, and support from her firm Davies. For those who don't know me, my name's Eric Foster. I'm a partner at Denton's, and I lead our firm's Canadian cannabis practice and also co-lead our firm's global cannabis practice. As Ryan alluded to, this is the fourth of 6 sessions, and I think, based on the RSVP, a lot of interest in this topic, which is so important, especially just some initial thoughts are, as cannabis shifted to become adult use in Canada, a lot of the focus was taken off the medical component, and it's really unfortunate, and there's such a huge part of the market that needs to be focused on this, especially as I'm sure something that will come up, or this gets more recognized by insurance companies, and people are going to be able to put this through their benefits. There's absolutely a massive spot in this industry for medical cannabis, but with that still come issues and pressure points, and really those are the things we want to talk about today. I heard a little bit of background noise before. I know this, for those who haven't used this platform before, it can be a little bit tricky. We want to make this an organic, helpful discussion, so really encourage you to raise your hands. I'm following along on the side of my screen, so I'll call on everybody and we'll try to make this kind of as organic a discussion as possible. So feel free to just pop your hand up. I'll call on you, and looking forward to hearing what everybody has to say. And I guess, I don't see anybody who wants to make any initial comments, but I think that the initial topic to kind of cover is just a general overview in terms of what folks think the impact of legalization of recreational adult use has had on medical cannabis production, distribution, the impact on medical patients in Canada. Obviously, as Ryan alluded to, what we're looking for here is industry feedback about what changes Health Canada really should consider to the legislation in order to improve, the medical cannabis regime, whether that's something as simple as access to it or otherwise. So I'm just hopping between screens here. I don't know if anybody has popped their hand up with any initial remarks or thoughts, but again, I don't expect this as a shy group. So I'll see if we'll give a second if anybody wants to jump right in really and tell us some of the things that you're experiencing, how the adult use regime has impacted things so far. So I do see a hand up, Elsie. So maybe we'll unmute Elsie.
Elsie, go ahead and unmute yourself.
Thanks. Sorry, trying to learn the platform a little bit. My name is Lisa Cohen. I will say that I find accessibility has been really, really impacted in the last year or so. A lot of legislation seems to have come down for medical cannabis users at the same time as the recreational market sort of got launched. And I think a lot of that legislation has really created some accessibility issues for certain people. So for myself, I use medical cannabis for a rare disease. It impacts my gross and fine motor skills. And things like the packaging requirements have really created barriers of access for me. I think the other thing is obviously access in terms of affordability and in terms of quality of product. It seems that a lot of the licensed producers, for example, a lot of them have stepped into that recreational market as well. And it just seems like the quality of what we have access to nowadays, the frequency of seeing sort of the strains that we need has really sort of diluted, because it just seems like there's more sort of demand for the product. And I think that's really impacting medical cannabis users' ability to access the types of strains that they need and in the quantities that they need. And then, of course, that excise tax. That excise tax has been really, really killer. The cost of medical cannabis has gone up exponentially. I was just looking at my income tax for what I've claimed, and just in the last 3 years alone, I've increased by $3,000 to $4,000 a year every single year since that excise tax has been implemented. And I think that's creating huge barriers of access for a lot of cannabis patients.
Yeah, no, so it's great comments. And I know the excise tax is something that's near and dear to everybody's heart, and probably not a positive way. But interesting, a couple of interesting points there. And on the access thing, I'm wondering, like, have you found there's been issues in terms of, the actual ability to access it, or is it just almost selection, right? Is it the fact that you're feeling that a lot of the people who have these licenses that patients were relying on as their go-to LP have now shifted their focus? Because, that may not be a legislative thing, almost that's more a business thing, like, but I think it's a totally valid concern, right? There's a very important community out there that needs access to this, that are used to a specific type of medicine. Like you almost equate it to you're on one medicine for an indication. That indication you still have, but all of a sudden that medicine's not available and you have to shift to a new type of drug. So is that one of the concerns I think you're trying to raise?
Yeah, I think it's not even just necessarily like the supply piece so much as the type of supply. So a good example is I'm someone who uses really high THC doses for certain medical needs. And I have had to switch licensed producers like 4 times in the last 2 years because I will register with a producer. They'll have something that meets that need for, a week, and you put in a purchase. And then I've sat for months and months and months waiting for a new product to come out that meets those needs, and it just never comes. So I've had to shift every single month to a different producer to find the type of cannabis that I'm looking for.
Yeah, no, it's not something. It's not the first time I've heard that from people. So, but it is a legitimate problem. I see Malka has her hand up, so maybe we can get some comments from her.
Thank you, Eric. So I'm Malka LaBelle from the Green Generation Company. I totally hear what Elsie or Lisa is saying, and as a personal medical user, looking for a specific strain to treat my own issues, that has been almost like not possible because you're dealing with both the rec side and the recreational side sort of blending into one from the same group of people that supply it. I wanted to share a solution to this that came up in a subgroup that I'm a part of, in talking about having direct access between growers or craft growers or former ACMPR growers that have licenses to sell directly to the patients without the middle people, all of the middle channels in the middle. So BC, I think, is looking at this. I think that in the situation, I think this is an example where the patient needs to direct the grower what they need and find the right strains and cultivars and genetics that match the patient needs and cut out the middle piece entirely. And I think that will allow the reason why cannabis was legalized in the first place to get to that point faster. The patients are the ones that know what they need. They've been using it probably the longest to treat their symptoms or help them have a functional life. And the legalization process has just thrown that back like decades. So my suggestion is to have a framework within the legalized way that allows the patients be matched directly with people that have a license to grow. It may not be in their same province. Maybe it's a larger network across the country and using some sort of an online platform. There are already companies that are doing this and using that technology and bring the people together to create the right product for the medicinal users' needs. That's my suggestion for that. Thank you very much.
Yeah, no, so to put it bluntly, I guess, you don't think the current regime adequately addresses some of the issues and concerns that medical patients are facing. And I see there's another hand up here, so maybe we'll go over to Maya.
Maya, go ahead and unmute yourself.
Okay, so we'll give Maya.
Oh, I'm sorry, I was muted. Sorry about that.
Okay,
sorry about that. I'll start over. It's on Maya. It's Daniel.
Okay.
But in any case, hi everyone.
We both from Terpene Oil,
yes.
by the way. Yeah.
I was saying that I myself, as a patient, of the last 5 years.
Biochemist.
As a biochemist and as an educator and as a naturopath helping a bunch of cancer patients with improving their quality of life during treatments and so on and so forth, what I've noticed is since legalization is the lack of consistency in all the cultivars. So even if you have access to one typical cultivar, most LPs have degraded their quality, I should say, up to a certain extent, in the sense that terpene profiles are no longer available. And the reason they're no longer available, because for the last year and a half, I've noticed a serious degradation in the content of cannabinoid, consistency, and terpenes in the flowers being out on the market for medical use. So obviously it doesn't affect somebody who wants to get high with the 27% THC strain to play, but it does affect the patient when there's no myrcene or there's not enough limonene or there's not enough of other terpenes in the flower. So how do we expect to have consistency for medical use if we're focused on the recreational market? I think there has to be a separation here, and I think there has to be an indication of a complete indication, a complete profile on each cultivar, each strain, so the patient knows what he's using. And if we have no consistency, there's no way that we can talk about medication. And I'm not talking pharma grade. I'm just talking at least to have the same terpene profiles, even if the concentrations are not as high, but at least that part. So what I have to do is make in my oil, calculate and change and mix and calculate how much biomass I need each time to get the same oil profile at the end of the day. And I don't think anybody's really thinking about that.
Yeah, instead of setting by quantity.
Yeah, exactly. So yes, it's true. And the difficulty in getting the same cultivars on a regular basis, I agree with what was said before. It's very complicated. It is very complicated for a patient.
So again, a very similar point that was raised before, and a really good point. The thing that I think we should all think about is how we can how we can fix that problem, albeit through legislation, right? Like a lot of these problems are issues that I think the producers themselves, like you talked about, are facing, right? It's hard to maintain that consistency, and that's exactly what we've heard. You know, we've heard several people already at this roundtable raise that issue. You know, there's only so much that companies can do. You know, what we're trying to do here, obviously, is to change the actual legislation and do it in a way that will allow these companies to be successful to address some of those concerns. So there's no doubt that it's a huge issue for the industry and for the community right now. And I think it, you know, behooves all of us to come up with a creative solution, changes that we can make to the actual legislation that will enable these producers to have that better consistency of cultivars, have that consistent availability, right? There's so many pressure points on producers in the industry right now that I think the overarching goal of this is to just make their lives easier so they can do what they're supposed to be doing, which is running a successful business where they have consistent product available to the market. And I think those changes do have to start at the legislative process to kind of unburden some of these companies. I see Ashley Brown has popped her hand up, so maybe we'll go over to Ashley.
Hi, friends. Thank you so much for putting this very important consultation on. I'm really happy to see patients represented and a cross-section of individuals here to add their voices to this part of the discussion. The point about transparency and consistency, I do think that those are two separate and very important issues. One, it has an impact on both patients and licensed producers in terms of their ability to provide consistent medication. But I think the other piece is that we do need that transparency. So if there's a variation in, you know, terpene profiles from batch to batch, if we know that as patients when we're purchasing that medication, it allows us to make better decisions. So variation is one piece, and not inevitable given that it's a plant and where we're at. But more importantly, the one piece that I would like to see really focused on from a legislative change perspective is what information is mandated to be available in the medical stream. I definitely have seen fewer terpene profiles be available. In our community of 10,000, we have several patients who actually have identified that they have an allergy or severe sensitivity to terpenes. So the presence of those terpenes in those products that they're using for medical purposes can have health implications. So I get a lot of pushback from licensed producers that are unwilling to provide those C of A's or even terpene profiles and full ingredients. And the comment is made that this is proprietary information. As a patient, that's a really hard pill to swallow, no pun intended, because again, this is medication and there can be sensitivities, and also I need to understand what is information. You know, no different than eating something without knowing the ingredients and having an adverse reaction, right? So I think that there's two pieces that are separate and intertwined. There's consistency of medication, which, you know, hopefully we'll see progress, but there's also transparency. And I'm very aware of the fact that, you know, testing for terpenes and full profiles costs money and labor intensive to update this information. But the idea that it is in any way proprietary, given that we are discussing it in the context of medication, is one that just doesn't fit well with me in terms of how to forward on the legislative front.
No, it's an interesting point, and it's a real actually distinction in terms of what we've heard on from a lot of the other sessions that were focused more on the economics, I would say, of the industry, whereas everybody's saying, well, the government's only looking at this from a health and safety perspective. You know, it's only mandated by Health Canada. They haven't really given it an economic platform. But again, what you're talking about is a situation where even though it's, you know, this is entirely run by Health Canada effectively, they're falling a little bit short in terms of what they're requiring in terms of access to information for patients. So, you know, it's interesting because it hasn't really come up yet, but when you think about it, it makes a lot of sense. So something I think definitely we should noodle on a little bit more as a group, but I think Malka's back with her hand up, so maybe we'll jump over to her.
Yeah, thanks. Ashley, that's a good point. I think the proprietary response is the same way a drug company would have said our blend of magical chemicals is proprietary and we have a patent on it, and therefore we're not sharing with you so no one can steal it and sell it at a lower cost. So I think that's a big pharma answer, and that's what we're trying to avoid here. So I think that, at least in my opinion, so I think that answer is not a good one. And like, I'm working with some lab companies right now to help them figure out how to streamline some of those processes so it is easier to get the terpene information out to the consumers in a more, you know, easy to deal with way, and not necessarily through the labeling. So I think one of it came up in a previous roundtable was about how, and also in the Cannabis Act review, was a question around, do terpenes and cannabinoid profiles need to be included on the labels? And I think the overarching answer that Ryan put together was, no, they don't need to be required, but it should be an optional leaflet, just like you can go to the pharmacy and get the optional leaflet that comes with your medication that gives you a lot more information about that information if you do care about it. So from that perspective, I think that every you know, profile or every cannabis produced in the legal system should be able, like, optionally, and if the consumers are wanting it, then there should not be a barrier to produce that information. The cost to do a terpenoid profile is not any much more expensive than doing a cannabinoid profile, and sometimes it's during the same test. So it just depends on how the lab is doing that, and there's more than one way, and that just determines the accuracy of the information. So the lab standards is more the region in which the consistency, clarity, and like to the decimal point, that science has not yet been determined at a Canadian Health Canada way. And I'm working with the ISO international body to figure out how do we create those so that internationally they can be recognized from the standards level. So that's all in the works. But I think the demand needs to come from the patients and the consumers. If you want to see terpenes on products, and there's been a positive push for that, keep asking for it, and the companies will comply, and that will win on the economic side as well as on the medical side.
Yeah, and it's interesting because, this goes back to kind of it's really quite different than what we've heard on a lot of the other sessions where, realistically, these companies, the LPs, and I'm curious, I know we have a bunch of, producers on the phone right now, so would love to hear from them because, what we've talked about in a lot of the prior sessions is actually reducing the regulatory burden. It's too much. The regulations is too hard. There's too much testing. And, what we're talking about now is actually moving it in the opposite direction now, albeit for what is absolutely a very valid reason. But I'm curious to hear if there are any LPs or representatives from LPs on the line, how this would impact you. Let's put aside the proprietary component, but I have also seen the testing forms, and I assume it is just as simple. I know there's going to be a cost associated with that, but it is check more boxes off of your form in terms of this is what we also want to get searches for. So I'm wondering how licensed producers would react to something like that along the lines of just how much extra cost would something like this create, and also would kind of this disclosure create some concerns tying back to the point that was made earlier around consistency of products, right? Like, you're buying a specific cultivar 1 week and you're getting that terpene profile, you're getting all that information, and then you go back to buy that same cultivar, 4 weeks from now. Is the composition of it going to look similar? Like, are producers at that point where they can they'd be comfortable sharing this information because you want it to ideally look consistent throughout the course that somebody is taking the product. So I have Maya, and then we'll jump over to Vlad for some comments.
Yeah, I'd like to add on to what Maka was just saying as well, as far as terpene profiles, cannabinoid profiles. This used to be done 4 years ago when I used to order cultivars from different LPs, and I won't name anybody here. There used to be some with full terpene profiles and cannabinoid profiles as well. And out of the blue, it became, instead of saying 21.2% on the website, CBD or THC or whatever it is, it became 15 to 22. And that is not good enough for medical. That might be good enough for recreational. But I'm sorry, and I don't think there's any more cost. It was done before. So why are we stopping doing it now? Because we're going faster, because we're drying faster, because we're evaporating faster, because we're not curing well enough? What is the reason? Why is a strain going from 15 to 18? And why isn't it 17 or 16 to 18 or 17 to 18?
Yeah, makes a big difference.
It's quite a wide range. I understand there's a cost involved, but there's no more cost involved if you consider that Health Canada requires an analysis, a third-party analysis of your dry flower, from my understanding, the same way they require for the oil. So it's not that much cost of an issue. It's not an issue of cost. I think it's more of a, and as far as regulation goes, I don't see why it's such a big deal for Health Canada to just say, and I've been discussing it with them for the last 4 years, why can't they just put on the packaging, this strain contains this, and this? And patients can get educated on the different terpenes. Patients can get educated on separate cannabinoids as well. There's more and more research coming out. There's more and more articles coming out. And the patients need to be educated because the doctors are not doing it. The truth. So who's going to do it? The educators and the patients. It's backwards. It used to be the doctors telling us what to do. Now we have to tell the doctors what we need as far as cannabinoids go. And that is an important point from a patient point of view and from also an extraction point of view. We're high quality extraction. So when we do extract, we want to be consistent. We consider it's a medication. We don't consider it's a recreational product at all.
And so we'll go to Vlad next, and then over to Nathan after Vlad.
Okay.
Can you guys hear me?
Yep.
Hi, everybody. Very interesting session. I'm very happy I was able to pop in and hear some of the perspectives. I can at least try to provide an LP perspective on terpenes, and this is my personal perspective as well. I am an avid cannabis consumer. I believe that the products we sell have to really delight the consumer at the other end, and people need to be motivated to actually find some benefit. Oh, we have some beeping here with the products. But here's my issue, right? We've done analysis and we've done studies to determine how does lab testing vary from laboratory to laboratory. And we found that there is an average of 10% variability between labs. So this is concerning, one, in terms of providing accurate information at best. At worst, this is subject to abuse, right? And there are labs out there that are offering increased testing in order to get business, right? So they want to give the LP the ability to give a higher C of A in order to A, incentivize the consumer to purchase the product because of potency, or B, just do B2B transactions, incentivize other LPs to purchase the products. So I worry a little bit about that. When it comes to terpenes, if we don't have a standard, which we do not in this country, of what a THC standard is for a laboratory, we are so far from that on terpenes. And we don't have standards on what are the terpenes we test. I can tell you that I can send one sample to 5 different labs. They're going to give me a fully different analysis of terpenes of every single lab. So here's my personal issue is, you know, Maya, I sell you my product, and I have used my standard laboratory that gives me my 5 terpenes. When you consume it, you're now making a consumer decision based on something that isn't 100% accurate, and worse, it's not reliable. So time and time again, you will not get repetition. And then what I personally really worry about is you will take this product to your lab and test it, and you will get a different result. And then everybody's gonna go on Twitter and accuse my company of misleading consumers, of not providing the correct data. And I think it's a no-win for anybody here. Where I think I would like to see us get to as an industry is more lab standardization, where I can send the same sample to every single lab, and not 9 out of 10 times, not 8 out of 10 times, 10 out of 10 times, I get the exact same result on what the contents of that material is. Up until we get there, I think that this just creates more problems and more confusion. And at the end of the day, that confusion and those problems are bad for the industry, are bad for consumer confidence. So that's kind of my view when it comes to terpenes and additional labeling. On top of that, I mean, as probably most people on this call, or some should know, to get a terpene test done with a lab is $300 per one batch alone. And again, if that was reliable, every single day I would pay for it, no problem. But that essentially it's, you know, kind of one of these, maybe it's here, maybe it's here. I don't see any value.
Yeah,
thanks,
no, really interesting, and thanks, Vlad. And again, that's exactly, you know, where everybody agrees or not, like that's just such a helpful perspective, you know, coming from a leading producer. So really helpful thoughts there. I'm sure that will spur some additional conversation, and we'll go over to Nathan now.
Thanks, everybody. I am lucky enough to be the co-chair, and I'm the CEO of Diplomat Consulting. Just wanted to quickly put that there. I think we're supposed to do that on our intro. We were having a conversation with a company in New Zealand last week, and they were indicating to us that they plan to have CBD health products over the counter by Q3. And we did a consultation in 2019 with a report that came out in 2020 to create a scientific advisory council that has no representation in Canada for the cannabis sector, which was some of the best government language I have seen, where that process will inform the process, which will create the opportunity to discuss the legislation that might have the opportunity to create those products coming to market. We have to really start having a conversation about how the world is advancing around us, especially as today is Inauguration Day in the States. The conversation about decriminalization and health products is going to ramp up. Canadian companies are going to be inundated with American health providers who are going to do what Americans do very well and spread their media and influence and brand across our borders very strongly. We need to have a really honest conversation very quickly about, we're not just losing our first mover advantage. we're not supporting patients and developing a medical health regime based on bureaucratic analysis and paralysis. And that is something that is ineffective and unfair for the people who sued to create the environment in which we lead and live in today. And if not careful, we are going to go back to a litigated point of view where Health Canada is going to have to defend its point of views in court again. Why can we not show the 88 people that are on this call that we all can work with Health Canada if Health Canada works with us to make sure that we create medical cannabis regime that makes sense for the people who have sued for the right for us to operate in Canada in a cannabis program, because the world is doing it and we're going to be on the outside left in. And they're going to create more opportunities for those products to be ordered across a border without regulatory oversight, because we're twiddling our thumbs thinking about how smart we are about being smart. And that's really unfortunate. And we need our regulators to realize that the world is changing around us and we need to catch up. So I just wanted to put that point of view, because Q3 is not that long away, and New Zealand is a big, interesting nation that we're all watching on as a fellow Commonwealth nation, and something for us to consider when regulators are talking about health products. We have to have a date in the sand of when they will have an answer and where we're and how we're moving forward. That's my diatribe. Thanks, everybody.
Terrific thoughts and points as always. I saw Sunfish Cannabis had their hand up. I'm not sure they still do. I think it was just taken down. So maybe we'll go back to our friends over at Terpene. Oh no, Sunfish has raised their hand. So let's go over to Sunfish first, because I know they got bumped in the queue. So can we just unmute the folks from Sunfish Cannabis, please?
Can you go ahead and unmute yourself?
Sorry, I'm just starting a store in Lakefield, Ontario. I'm outside actually too, as if it's windy, sorry. Just wondering about, I've noticed a difference from when I was a medical customer to when now with the legalized product, that it doesn't seem the same even. It seems to have changed. If they irradiated it or something. I don't know if anything's changed about the product since it went to recreational.
No, I don't think conceptually, under law anything has changed. I think the way in which, I think a lot of the producers have experienced growing pains, right? Maybe the way in which their ability to create that consistency of product. But in terms of, there's a wider variety now, but I don't think anything has conceptually changed the way in which these products are produced. Although I think you raised an interesting point there. If you are seeing it differently, does the group, and we'll put it out there, and I think this is one of the questions posed earlier, but, do we think that the current medical regime does create barriers that are leading individuals to either buy not through the medical channels, but either buy from, licensed adult use stores, or, argue, or certainly would be more concerning, the barriers are so high for people to access it that they're actually still buying from illegal markets. And that to me is just a horrifying thought, right? To think that there are people, medical patients who are having such difficulties that they have to buy illegally, right? Which would be, that is clearly against the objectives of the government here. So anything else to add there? If not, maybe we will go over to Terpene now. Terpene oil.
Yeah, it's Daniel. My name is Daniel. So hi everybody again, just in case. But just to go back to a bit of what Vlad was saying before about testing and standardization and testing, all that is very nice. But at least if we have an idea of what terpene profiles we have in the cultivars, the concentration is not an issue. At least to know what that cultivar contains. That's what's important. And I know that the standardization is all over the place, because some are starting at 200 ppms and some are starting at 50 ppms and so on and so forth. But from my experience as a patient and as a researcher, it's the combination of those terpenes that have an effect, a therapeutic effect, not necessarily the level of concentration of each terpene, but how they're combined together and how they complete the secondary and primary cannabinoids in the process. And I think that's where we need to pay attention. And it's okay that the standardization is not all over the same, but that doesn't mean that we're not going to put any terpene profiles. And yes, it's only $200 to do a cannabinoid or to do a terpene profile, or $500 to do both, depending on the labs. But it has to be done, and it has to be put on the package. Otherwise, what are we doing? We're just selling weed, basically. We're not selling a medical product. And that's what I wanted to insist on. And yes, it's true that the quality has gone down since legalization. I see patients getting flowers that are completely dry, or that have been packed in June last year. It doesn't make any sense. When it used to be sticky, fresh biomass coming out, receiving the patient was like, oh, this is good stuff, this is great, I feel better. Now we're not getting this in a lot of cases. And I'm not talking all the LPs, but I'm talking a lot of times. And I see it on the extraction end, the quality of the product that's being used.
So I see we actually have a number of hands up, but actually I'm going to skip back to the queue, and I promise I will get to everybody because we do have a decent amount of time left. But maybe if we can jump back to Vlad, because I saw he popped his hands up, and I think this is a pretty important part of the discussion. So maybe if we can jump back and give Vlad the floor for a minute. Oh, do we have you, Vlad? You may have to.
Yeah, no, you have me.
Yeah, we got you.
Yeah, absolutely, Maya. I think you raised good points. I love hearing this type of commentary. Here is kind of how the issue plays out in my mind, right? Again, saying a genetic is something that, in my mind, very difficult, right? How do we know what the genetic is? So some grower at some point in time said that this is an Afghan Kush, and that genetic now got rolled into a license under a Section 10, and now the company sells it as an Afghan Kush. I personally would like to see us get to a point where on the basis of a more standardized and well-researched terpene analysis and cannabinoid analysis, I can send my sample in as unknown to a lab, and that lab can tell me, here's the lineage, here's what we're working with. If we get to that point, then I have a lot of comfort in saying we're selling an Afghan Kush with this terpene profile, with this cannabinoid profile, and then allow medical patients to fine-tune their own needs and get them there. The problem is right now, like, you see this clustering of strains. So at the market right now, every single company has a black cherry bunch. At a few years ago, it was the Cold Creek Kush. It was the Shishka berry. I fail to believe that these are all the same genetics, right? And there is a little bit of this, people taking a bag of seeds and saying, well, what's popular right now? Oh, the Cold Creek Kush? This is all Cold Creek Kush. So I think we have so much work to do to get there. And I can tell you, as somebody that's been in this industry really from the beginning and somebody that's passionate about this, we're not there yet. And we have to keep fighting to get there, but we have to keep researching. And a lot of these solutions, I don't think, solve our problems. We need to work as a group and to provide patients with actual true access and actual information is the goal. But that's why you see some hesitation from me in the interim to say, oh, we'll just do a terpene analysis, or we'll just tell you what the strain it is, because I know that that's not 100% true. And I don't want to give people half truths. I prefer to get us to a point where we can say confidently, this is what it is. Thanks, Eric.
Excellent. Yeah, thanks, Vlad, as always. So maybe we'll jump back to Malka and then over to Dan Demers.
100% do I agree with Vlad's statements. The science and the research is what Canada is known for. In all of the panels I'm talking to across the world, they're looking at us to lead the research and the science of this, with sort of Israel behind us, supporting us as well with their previous research. So what I believe is exactly what Vlad said about how we figured this out is the balance of more testing, more research, but not as a requirement, as the industry wants it, because we want to show a balance of data that proves it. Because that's how scientific research is done and conducted, is doing a balance of a ton of research along a number of samples that collectively creates a standard deviation and a bulk of information in the middle that's the truth. So I'm waiting for someone to say, why can't we apply, Stats 101 to lab testing, in the sense of, I believe, like, the cost of testing a batch is negligible compared to the margin of profit that an LP would make off of that batch. Why don't they send it to 10 different companies and put all of that information in a summarized, like, this was tested 10 different times by 10 different labs. They got different information, but it's a plant. It does have variability from one point of it to another. So we understand that. It's not a chemical, like a standardized, individual molecule that was made in a lab. It's a plant that's been turned into a lab product. And I think that we need to go back to the plant science and say, well, we know that they're all different. Let's assume that they're different, and let's just look at a lot of different ones and let it tell us. Like Matt said, let's go back to that model and stop trying to make it into this consistent exact thing every time, batch to batch. Let's look at it holistically, as cannabis is legal in Canada, holistically has all of these profiles, and different strains have these profiles, and the balance is in the data and the research continuously being applied, not in trying to compare batch to one sample to one sample. That's my thoughts on that. Thank you.
Thank you, as always, for the contribution. We'll go over to Dan Demers and then to Barbara Miller, please.
Hi. So first of all, Ryan, thank you and the Chamber for setting this up. I think it's a really important discussion. I want to thank Nathan for his comments. Not only are you right on, but I love the attitude with which you said them. I do agree that we have to get ready to provide input to the review of the legislation, but we also have something right in front of us, which is an opportunity when we look at consumer-related products containing CBD. Now, some people might say, how does that directly relate to medical, et cetera? But from the perspective of the health food industry that I work in, we look at it as, if you use existing regulations to say what evidence we need to provide in order to support health claims, in order to prove quality and consistency and content on products, if we use those rules, it will drive investments in research, because you got to provide that data in order to have your products approved. So let's use the existing system. Let's do what Britain did, which is they used an existing system, but told industry what additional information they're looking for around safety, et cetera. Industry then does the research. We then get clear rules from Health Canada. We then develop and we invest in innovation and a rules-based regulatory system based on evidence. And we become the world leader in consumer products that consumers can have confidence in. So what does that do? Drives research, drives innovation, drives development, creates a lasting industry that will have great benefits on the medical side as well, because we'll have more research, we'll have more products, we'll have a better system. But it starts with not buying into Health Canada's view that everything must wait for the review of legislation. An election's coming up. We have an opportunity to tell the government, don't miss the opportunity to move forward on consumer products derived from cannabis, particularly CBD, and work together with industry to figure out the regulatory requirements and let us do what we do best, invest in research and create products. So I think if the Chamber wanted to, I would say drive this now, because the world is moving. Britain's going to have food products with CBD in it by spring. New Zealand will have CBD health products by next spring. What are we waiting for? We're waiting for Health Canada's review of the legislation. I think we need to put pressure on them now to say, move forward on this opportunity, and let's get all those other benefits as far as research and product development.
No, it's a great point. And, we've talked about in the past that Health Canada has held consultations around the sale of cannabis health products. They've established their advisory committee. But again, I think there's been a general theme that we've talked about in a lot of these sessions, that we're all just too busy patting ourselves on the back and not actually moving the narrative forward. And we are going to be passed very quickly, both from an economic standpoint, there's concerns, but more importantly, from a regulatory standpoint, by a lot of other countries who are looking at this and maybe taking a different and arguably far more practical approach and focusing on the medical community. But we'll jump to Barbara and then back over to Nathan, please.
Thank you. Can you hear me all right?
Yeah, loud and clear, Barbara.
Thank you. Sorry, my video isn't cooperating with me today. I'm Barbara Miller. I'm the head of the Cannabis Group for the Fasken Law Firm. I'm in the Toronto office. And I wanted to take a slightly different, or make a slightly different comment, and that is with regards to the medical profession. Among our clients are a lot of doctors and people who operate medical clinics. And they are very and increasingly concerned about the inconsistency in quality, the standards, and the inability to get a very clear picture on what they're prescribing. And that is, of course, causing or exacerbating the ability of doctors to prescribe patients and help them with their medical needs. So I'm wondering how we might be able to also educate and help the medical profession, which will in turn help the industry and make sure the products are being offered and provided to everyone who needs them in a consistent way where people know what they're getting. That's it. Thanks.
No, thanks as always, Barbara. And, you know, it's a terrific point, and I can tell you, speaking from experience, we've worked a lot, obviously, with you and your firm, and you guys are great, and you raise a lot of important points. And we'll jump back to Nathan, and then we'll go to Sarah Jane from J. Nelson. Sarah Jane, J. Nelson.
Thanks, Eric. I completely agree with Barbara. I thought that was a great point. I think, you know, again, I'm sorry, I'm going to be the guy that brings us back to the regulator. I think one of the things that has been missing in the development of a medical industry that, again, was the precursor for the adult use recreational environment that we currently operate in has been the judicial development of a medical system in Canada. And I think one of the things that we forget is that there hasn't been the education and information that perhaps could have been supported from Health Canada to health professionals and the citizenry to try and create an opportunity to drive a conversation about the role of cannabis as a health product. We're not saying sell the product, but the fact that we've unfortunately have a number of stereotypes that the sector has to overcome, the opportunity to provide a flatline basis of where cannabis is and where it is going to health professionals, potential personal health insurers, led and overseen by Health Canada would give a lot of legitimacy for the conversation. And I think it's a fair request of the cannabis sector to hopefully ask Health Canada to work with the sector to provide that baseline information so that health professionals can start having that conversation, so that they can talk about longitudinal studies, opportunity for research. I want to give a shout out to Dr. Jane Alcorn, who I don't know if anybody knows, from the University of Saskatchewan, who runs the Cannabis Research Institute of Saskatchewan. She was sharing with us the other day that she has a pediatric epilepsy study that she found 85% success with a small test group, where kids that have 150 seizures a day had an 85% reduction in that. She wants to grow her test group to include 100 children, and she can't get cannabis to do her research. She relayed the fact that it's easier for her to get heroin than cannabis. If we're going to talk about the development of a medical cannabis system developed and supported by research and innovation, there's some fundamentals that we are unfortunately missing that hopefully we can work together and push the regulators to create an environment where that happens. Because if we don't think the innovations that the Israelis had at the beginning with the introduction and identification of CBD and THC, now that they're moving to full legalization, it's going to be very interesting to see how that develops. And hopefully we can spur that conversation to really make a difference with the full cannabinoids in people's lives. So let's continue to ask and hopefully get Health Canada to help us build a flatline foundation for cannabis sector to have informed conversations that we can jump off together. So I'll go from there. Thank you very much.
Passionate and eloquent as always, Nathan. We'll jump over to Sarah Jane and then over to Aaron Gradden after that.
I just want to acknowledge that I'm not a great public speaker and I'm feeling really nervous. But given that we're having a broad discussion about medical cannabis and meeting patient needs and the impact of adult use market, I'm coming from this as a patient. I have a background in nursing, and I'm also a minority shareholder of a retail pot shop in Fernie, BC. And I do support recreational access because it brings customers into safe supply, informed choices, and a new stream of revenue for all Canadians. But There is nothing available in pot shops right now for patients. We are completely muzzled from even saying the word wellness. If any of you have taken the Selling It Right course with British Columbia, you will realize. So patients today who are curious about cannabis, being that we just legalized, really don't have a lot of support if they're brand new to experimenting. Their doctors aren't willing to talk to them because the CMA has muzzled doctors. And we at the retail shops are accommodating customers. But for the naive, there's really nothing there. And I think that that has to change. We need to be allowed to talk about how this is helpful for health and wellness.
Yeah, no, it's helpful comments, Sarah Jane, and again, you know, right on point. And I think you are a very good public speaker, actually, for whatever that's worth. I thought that was a terrific addition to the discourse. So thank you for that. And now we'll jump over to Aaron Gradden and then over to Matthew Herbert, please.
Hi, everyone. And Sarah Jane, that was really well said. I do public speaking, and I am currently also nervous. So thanks so much for having this discussion. I came here today to collaborate and hear all of your opinions and perspectives on this. I think I bring a slightly different perspective than many of you, so I'm here to share that, of course. I am both a medical patient myself as well as a human resources leader. So in these discussions, I am thinking about patients as employees and workers as well. So on the conversation around barriers, one of the things that I think is very commonly known and talked about is the reality that doctors are still referring patients to the OCS and retailers. And in other areas, like I'd say many people in my own life, especially ages 60 and above, they're really going to the retailers because it's the easier route. Actually, a lot of people I know are just going to the retailer because it's the easier route. And then, of course, some people are still going to the illicit market for cost. So the reason why I bring this up is I believe that, people and the decisions that they make in their employment, they generally want to be able to medicate safely and legally at work. And without risk to their employment. I would say that since legalization, there's been a stronger emphasis on employers making sure their policies are updated to protect the corporation, but not as much emphasis on worker education. So workers also really want to be able to access medical cannabis for workers' compensation. The last report I saw from the Institute of Work and Health was that 16% of workers reported that they were, I think that was in 2019, I haven't heard the 2020 reports yet, but 16% were medicating with cannabis for injuries at work. And I think that we're going to start to see more and more workers demand for that. So, excuse me. So what I'd like to recommend is that where we're having a conversation around health products containing cannabis, I think it's really important for Health Canada to be considering patients in all aspects of their lives. And the reason for this is I think that the most impacted group of workers are those who are in safety-oriented jobs and those who are perhaps frontline workers And so it's important that whatever regulations are surrounding these products, that there's some type of oversight or consideration, or maybe perhaps going back to the previous point, some kind of evidence-based information, so that those products are supported. And as workers see these products as an easier access point, that in turn, industry like oil and gas or other like safety sensitive fields or non-safety sensitive fields don't end up weaponizing that classification of products to workers, because ultimately the ability for workers to safely medicate with cannabis in a manner that is associated with disability per our human rights legislation is really important. And financial security ultimately impacts our communities. So that's all I have to say. Thank you.
Terrific. So we'll jump to Matthew next. One thing I just want to note to the group, we've talked a lot about the medical regime. The other kind of topic that we haven't exactly touched on yet is cannabis health products. And as I alluded to earlier, Health Canada has established this advisory committee that's going to be, providing all sorts of support to the government's development of their actual regulatory model for cannabis health products. So some of the questions, and you would have seen this in the questionnaires that were sent out around, but should non-THC based cannabis health products be regulated differently? Should trace amounts of THC be allowed in cannabis health products? The thought of general health claims allowed on cannabis health products. So I know we have a lot of people in the queue who've been waiting a long time, so we'll keep going with the queue, but would love to hear thoughts on a regime for cannabis health products. I think it dovetails obviously quite nicely into some of the other things we've chatted about, so would love to hear people's thoughts on that as well. But we'll jump to Matthew, Herbert, and then over to Kim Purchase.
Thank you, Eric, and thank you everyone for your participation and engagement in this. I'm a product owner at CanScript. We're focused exclusively on helping to solve some of the frustrations that people are experiencing in the medical cannabis space. So I think this is both a very timely exercise that the Chamber of Commerce is focusing on, as well as a specific area of the cannabis framework that I think is something that I would love to see the whole industry really focus some attention on, because we're seeing patients are beyond frustrated trying to take control of their healthcare and deal with chronic conditions, and they lack the information and tools and support to be able to do that in an informed way. You have healthcare providers who are completely overwhelmed at the moment, not just in Canada, but actually globally. And so I think we have to be mindful as well that we're not operating in a business as usual environment, but we're operating in a place where the healthcare providers are both trying to figure out how to provide their services virtually, but also how to prioritize patients with chronic health conditions in an environment where you've obviously got this acute virus rampaging the world. And so I think we need to be mindful of that in the way that we communicate to Health Canada as well. And I think that there's really an opportunity for the industry to cooperate here. I know that the industry is highly competitive, and Canada has a real role to play, I think, internationally when it comes to medical cannabis. And I think where recreation, we see a lot of competitiveness. Hopefully in the medical stream, we could actually see this as an opportunity for the Chamber of Commerce and licensed sellers of medical cannabis to actually come together and look for opportunities to cooperate in a way that serves their clients and also serves their businesses and actually helps this medical stream grow. I just want to touch on a few points very, very briefly, because I think that there's a supply chain issue here, and it's not a specific regulatory issue. I know a lot of the time it's really easy to point to Health Canada and the regulations and say, this is why things are tough. But I actually think that with the benefits of technology and with some real commitment from the industry, perhaps we could see medical move to the preferred route for people who are looking to use cannabis for health and wellness, rather than the third option behind, Gary around the corner and any of the recreational stores downtown. So I think the first challenge is authorization. You've got healthcare practitioners, obviously it's physicians and nurse practitioners that are entitled to prescribe, but I'm not seeing a lot of authorization happening in primary care. Finding patients are having to go to specialty clinics, often with additional charges on top of that in order to be able to even get access to the medical stream. That's not necessarily a Health Canada issue, that's more of a provincial colleges issue. And I think if there is an opportunity for Health Canada to work with provincial colleges and help to make physicians and nurse practitioners more comfortable with prescribing, rather than feeling like they're under additional undue attention and undue risk, then I think that would be fantastic for patients. Also, I think perhaps in terms of a regulatory change, we might ask Health Canada to open up authorizations beyond physicians and nurse practitioners to other licensed healthcare practitioners. I'm not the person to say who that is, but obviously pharmacists in Ontario have all completed a prescribing education course. There are many nurses that are more than qualified and are helping these patients with chronic conditions, and so perhaps we could be a bit more reasonable when it comes to those that are entitled to authorize medical cannabis. I think a second challenge here is industry bureaucracy. It's not you have to register patients, you have to satisfy all of your regulatory compliance, there's documentation, there's processes. It makes it a challenge, first of all, to onboard a new patient and turn them into a client, and then actually keep them when it's much easier, again, to go around the corner to Gary or to the local recreational store. And so I think this isn't necessarily a regulatory challenge. There is a regulatory burden here, but I think that what I've seen, we can reduce the administrative burden associated with this. And I think if the industry were to focus on cooperating in this space to remove the burden, for example, creating a single sign-on for patients to be able to order from their different producers, a simplified switching process, so that patients aren't lost in the secure faxes and the bureaucracy when they're trying to access the right product and the right dose at the right time, the right place. And so perhaps these are areas that rather than Health Canada taking a role in this, we could actually look to the Chamber of Commerce to coordinate specific groups of members that are focused on areas in which are not competitive, but actually could be areas of cooperation to improve the experience for patients, and so as not to overburden them, but also make it easier for healthcare practitioners that want to participate and enable medical cannabis as part of the patient's holistic care program. Third minor point, excise tax really needs to go here, and I think this is one that could be lobbied on with Health Canada.
Yeah, thanks, Matthew. Great point. And again, I think, you raised, it's interesting because even you acknowledge right off the bat, like these aren't necessarily regulatory issues, right? And that's obviously what we're focusing on primarily, but the goal obviously is to make those regulatory changes that allow these companies to thrive and have the ability to collaborate better while still being successful economic enterprises. But obviously really, really interesting pressure points you've talked about and concerns. So we'll jump to Kim and then to Ashley and then to Cameron. And again, encourage folks to talk a little bit about cannabis health products to the extent folks we haven't covered that too much. Obviously, we can bring it up at future roundtables too. Want to make sure everybody gets their chance. So we'll go over to Kim and then to Ashley and then Cameron.
Good afternoon, everybody. My name is Kim Purchase, and I'm the National Director for GR for Aurora Cannabis. Nice to see some faces on here today that I haven't seen, but I am well familiar with. The first thing I think I'd like to say is back to something Barbara said earlier. I'd be really interested, Barbara, in having a discussion with you about collaborating to help doctors get their information. And I say that because I have tried so many overtures with the Canadian Medical Association, to try and get a sense of where they are with their positioning now, what their views are on the medical system, and how we can collaborate. So if you have some ideas, please feel free to reach out to me. I would really appreciate it if you do. The second thing I would say is that, you know, with respect to research and the information that's available, we have been heavily involved with Health Canada to try and get, you know, some movement on the ability to do research in this country. We are previously held to a standard that really is not, it's not really easily applicable to cannabis. And we're really pleased lately to see that they are consulting on this. And we have participated. I suspect many folks here did participate in the recent consultation on research, and hopefully we'll be able to move the bar on that one. But I think for me, you know, there's a lot, and I do want to bring it back to CBD and CHP. And the reason I want to do that is the main reason I joined this call today is I had a feeling, given that it was medical cannabis and CBD CHP, there would be some fairly knowledgeable medical cannabis advocates on here. And from the perspective of an LP, a Canadian LP with a global footprint, who is engaging and preparing on not only statutory review, but on CBD CHPs, I'm really, really interested, and we are really, really interested in hearing, for example, as we move forward in this market, there are a lot of patients who, you know, earlier there was a large discussion about even the necessity of a terpene profile. I'm really curious as to how folks on this call see the market when, you know, we have CBD products that are wellness products, food products, natural health products, regardless wherever we go with governance, and how you see medical patients accessing medical grade CBD products in this sort of post-Cannabis Act world. So, you know, from my perspective, I think that is something we would be very, very keen to see, because obviously as a producer who's been around in the legal system pretty much from the beginning, one of the original license holders, medical patients remain an important part of our business and an important part of what we do. So, you know, if folks have things that they would like to say about how that market looks and how it segments, I'd be curious about that. But I would also welcome the folks who don't already know me. If you have thoughts after this, please feel free to reach out, and I'll put my email address in the chat for folks who don't know me. Thanks.
Terrific. Thanks, Kim. A little bit mindful of time as we're getting close to wrapping up, but we'll go over to Ashley and then Cameron and then to Megan Henderson and Raheem after that.
Thanks so much. I want to be very mindful and respectful of everybody's time, so we hear from the other voices that want to share. Just for a little bit of context, my name is Ashley Brown. I'm a medical cannabis patient who treats epilepsy. I was having 180 seizures a month before I found medical cannabis, and I now have about 15 to 30. So medical cannabis is extremely important to my quality of life. It's also allowed me to return to work and to advocate on behalf of other patients. In 2017, I founded a group called SheCan. SheCan now has over 10,000 members across 3 platforms, and we focus on access to legal medical cannabis. So our member base, to give you an idea, are purchasing roughly $40 million a year from the legal market. So they are high needs, high engaged patients. And as Lisa Cohen has wisely said on more than one call, medical cannabis patients are often patients for life. So they have a very vested interest not only in the future of medical cannabis, but also in the future of CHPs. I think that my question to the group is, since this is a working group and the Cannabis Chamber often represents businesses, is, you know, it is my intention as an advocate to work with businesses who are actually interested in serving patients, and I know they exist. So there are companies who are working very hard and spending a lot of money to try and stay in medical. And I guess my question is, how can the regulations incentivize companies to get and stay in medical? What kind of, you know, ways can we serve the patients and also allow these companies to stay solvent so they can continue to offer quality medical cannabis to patients. I think the industry looks different than it did pre-legalization, there's no doubt, but there are some good actors in this country who may benefit from, fast tracking licenses, tax credits. Obviously, I think the Ministry of Finance needs to be involved in the excise tax conversation, but 90% of SHECAN members are going without or underdosing their medication as a result of cost. So cost is an impact on the producer side and the industry side, and it's also impacting patients. When it comes to CHPs, I'm a little bit hesitant on this front because I think it becomes dose dependent, specific to CBD. As somebody who requires up to 20 milligrams per kilogram of CBD a day, I would like to see more research done because there is some indication that there are there are contraindications to medication, which I know Rahim can speak to because the pharmacist perspective is so important, on this forefront, especially as we start to consider some of these health products. But I think it's also important to address the fact that liver toxicity has showed up in more than one study. So I think it's going to be dose dependent and dose sensitive. Can we prove some of those claims? If people are looking to this to be in the CHP market on the patient side because they want it to be simpler to access, that's one thing. If it's something that we see as a benign substance or something that is relatively, minimal risk, that's a different discussion. So is it an access issue? Is it an affordability issue? Or is it also just a therapeutic issue?
Terrific. Following along in the chat, and again, encourage everybody to participate and follow along in the chat. Obviously, you got a lot of fans out there, Ashley, no doubt about it. So we'll go over to Cameron next, and then Megan, and then over to Rahim, who was alluded to a few moments ago by Ashley. But over to you, Cam.
Thank you so much. A couple things. One, I just want to reiterate something that Ashley said, and with regards to finance having a role here on the excise piece, they are literally the ones who have the role when it comes to excise, not Health Canada. Health Canada has, to their credit, during my time at Organogram as well as with C3, as well as with Tilray, they have run this up the chain before. We have spoken to Bill Blair about this. We have spoken to different members of parliament of all sides. It really is a question of will. So if people want to see this done, I would suggest advocating very strongly for your local MPs and to go directly to Minister Freeland's office and pound the pavement for it, because so far they have resisted any sort of bend on this, and Health Canada has nothing to do with the taxation regime. On the solvency question, I would just reiterate again on the excise. Yes, there are LPs out there. I can tell you, Organogram being one of them, we eat all of the excise, and I think Aurora, I would guess as well, we eat the excise tax. A lot of patients say, well, you're passing the excise tax on to us. In many cases, small, medium, and large LPs are actually eating the excise tax, so you are not actually paying that at source. I'm not saying that's the case for everybody, but as somebody who's come from the LP world, it does bug me a little bit when patients say, well, why are they charging excise? Well, in reality, they're not. A lot of them are eating it, and that's unfair from a business competitive standpoint for that to continue. A couple other things. I would caution about things when we talk about, and I take what Sarah Jane said seriously about the accessibility, I really do, but I would just caution on the blending of the recreational and medical systems. The more that you do that, the less likely you're going to have any sort of leniency or openness to treating them differently from a tax or coverage perspective. It would actually be better from the government's perspective, the federal government's, and I would say provincial, to have a melded system where recreational and medical were no different, because then they could continue to slap an excise and sin tax on it, and patients would still have to pay for it. So I'd be very careful about trying to kind of position it that way. I can see why it has some benefits, but at the same time, it has a lot of downsides that I think hurt a lot of patients in the long run that probably are not accessing that cannabis right now. I would also just say with regards to the medical community. So, again, I think that for the medical community to take this seriously, we do need to have a sustained dialogue with them. I know that sounds, pie in the sky in some respects, but, if you're going to see this medicalized in any way, shape, or form, whether it's the CMAs or the different colleges, be they pharmaceutical or medical or what have you, there needs to be clinical practice guidelines. The reality is that, yes, there are patients who can speak to this from a wellness perspective. There are bud tenders in recreational environments that can certainly speak from a from an experiential perspective, but they are not medical professionals. And there are a lot of individuals, if you want to normalize this into a broader category, and I know, my mother is in that category, my sister is in that category. Many of us have friends or family, if ourselves are not the patient that we know are patients, who would prefer to deal directly with a medical cannabis or on medical cannabis, be it authorizations, prescriptions, what have you, directly with a medical professional. So I think when we talk about that access, we need those clinical practice guidelines and an ability to have a conversation, if we so wish, with our physicians. A couple other things, and I want to touch on CHPs. One other thing, though,
Cameron, I'm sorry to interrupt. There's just a bit of a long queue, so happy to let you keep going, but I just want to be a little bit mindful of the time. But would actually love some final thoughts just on CHPs.
Yeah, okay. So our pharma accessibilities, by the way, the provinces already do have those abilities to make these products accessible in pharmacies right now under the Cannabis Act. I think it's section 61 or 69. On CHPs, I would also just say that directly on this, I think the retail restrictions that have been proposed by the federal government on cannabis or CHPs are ridiculous. You have to be 18 years or over to go into a store to pick up a high CBD product under this potential a consultation document, yet we can send people in, or kids can go in, or teenagers can go in and pick up natural health products like vitamins, selenium, St. John's worts that actually have serious impacts if not used properly, and they have more accessibility than what is being proposed here. I also would support, and I think it's worth saying, that we need to ensure that we have a more liberalized labeling regimes for these CHP products. We cannot, we have to treat them in the categories for which they're in. We can't be slapping, stop signs or this, that, and the other on things, whether they are shampoos or lip balms or what have you. So I think that we need a regulatory or labeling approach that is synonymous with the various category of product that is being used. And we also have to look at that accessibility issue in a different way than I think we would recreational or medical products. Thanks.
Thanks, Cameron. So mindful of time, and I know we're going to go back to Ryan to wrap it up, but let's go to Megan Henderson and then over to Rahim. And I think after that, we'll probably have to put a pin in it, but obviously we've got a couple more of these coming up. And I think can always be a little bit flexible on the subject matter. So would if we don't get to everybody. But maybe some last two comments before we kick it back to Ryan. First to Megan and then over to Rahim.
Okay, thanks, Eric. I'll try and be brief. I came in late, so hopefully I don't echo points that have already been made. But I am currently running a medical clinic servicing patients across the country. And one of the things, a couple of things I want to mention. One, I hear a lot from patients that if they go to a clinic, not ours, but other clinics, they're being forced to choose LPs based on that clinic's relationships. I think that's morally wrong. As a clinic, we do not force our patients to go with our partners. If a patient comes to us and they are authorized, it is our responsibility to make sure that they go where they want to go. And I think that this is a fundamental thing that we need to make sure whatever changes come to the regulatory side of it, we need to protect patients' rights. And that is, I think, their right to choose who they want to be with. Whether we get an education fee or not, it's not our job to force them into that slot. And I think there has to be a change to that and a regulatory change to ensure that doesn't happen and protect patients. So that's one thing. The other thing I want to mention too is we work with a lot of motor vehicle accident patients and personal injury patients, and we are HCI designated, which some of you will know what that means, but for others, it allows us to direct bill on behalf of that patient if they're approved for their treatment plan. And not a lot of medical cannabis clinics that I'm aware of have this designation, but what we're seeing is denials from insurers because there is a lack of a policy around medical cannabis treatment. And from insurer to insurer, not only are we challenged with whether or not they'll provide coverage, but in the case of a motor vehicle accident where they're completing an OCF 18, we are getting denials for reasons like previous recreational use or any manner of issues, whether they tell us or not, that is forcing that patient to delay their treatment or pay for it out of pocket when there is no reason why they should be denied based on the clinical examination. The other thing we're seeing is that often when we submit these, the insurers are sending them for a third-party assessment. which to me, again, is a bias because they are being evaluated by a healthcare practitioner, whether it be an MP or an MD. So why is that practitioner's evaluation not valid enough for them, ensure that they need to send them to one of their preferred? We know this is a challenge across many healthcare. It's not just medical cannabis, but I think it's something, again, where we're seeing a lot of bias from these insurers on this front, and it's affecting patient care. So they're not able to get the support that they need or even get the consideration for this treatment plan, which is deemed not only by their cannabis professional, but by perhaps their occupational therapist, their massage therapist, their rehab case manager as a valid therapy that they want this patient to explore. So I think there's a lot around the regulatory issues around insurers that need to be addressed as well for patients. And then just echoing Ashley's points around cannabis health products, I think we need to understand and look at, are we using this for wellness? And in that level, we need to have a cap on how much CBD would be present in an over-the-counter product versus are we using it to treat a chronic condition like anxiety or epilepsy or Crohn's and colitis. And then that needs to be under the care of a healthcare practitioner to ensure a successful outcome, that they are dosing and titrating correctly, etc. That's kind of my highlights.
Sorry, Megan,
thanks so much.
Terrific, thank you. And again, just mindful of time and really appreciate everybody's engagement. So I think last but certainly not least, we'll go over to Rahim. I know he's had his hand up for quite some time, and then we'll maybe turn it back to Ryan for some final remarks and updates on steps going forward. So over to you, Rahim.
Thank you so much. I'll be very brief. I want to give you, my name is Rahim, I'm a pharmacist. I want to give you the perspective of a pharmacy that specializes in medical cannabis. I have a pharmacy here in Ottawa, and we see patients on a regular basis. Now, looking at the current registrations that came up in stats, we noticed that it has completed from March of last year to this year. And this is not because patients are magically getting cured and they no longer need medical cannabis. It's because they are accessing an easier system. And if we're talking about medical cannabis in this country, I'm going to say this very bluntly, we are failing patients. We are failing patients on an access level, because 1 out of 4 of these people are walking into recreational stores, buying their medical products and asking medical questions there. And it's a very inappropriate place for these patients to go. Patients like Ashley, patients who have seizures and cancer and a lot of other medical ailments, they need to have an access point like the recreational market has. And what I'm suggesting obviously is a pharmacy dispensing model, like I've started here. Number 2, I've seen a lot of patients come in here with illegal products, and I'm sure the mandate of this entire legalization of cannabis was to say, let's get rid of the illegal market. But people are bringing in CBD products left and right that are buying from Amazon, buying it from the States, buying it from all these illegal online dispensaries and whatnot, and they are confused because they are finding it, they're thinking it's legal. And I think we need to regulate the CHPs for sure. I think that needs to be very much in tune with what's currently over the counter. Studies can come and studies will come, but we can obviously regulate, and it should be treated similar to what codeine is right now. Codeine number 1, it's 8 milligrams of codeine or less is available over the counter. Anything above is available behind the counter with proper medical oversight. We can treat CBD the same way. X percentage or less should be over the counter. X above should be either prescription and or based on a healthcare provider insight. So that's my 2 cents on it. I think we need to really adjust the regulations and adjust access for patients.
All right. Well, nice final remarks. Again, I do see there are a couple of hands up, but I'm mindful that we're already over the time for today. So maybe I will just kick it back to you, Ryan, for some final thoughts. And again, really a terrific session. I think maybe the best one we've had so far. Really just terrific engagement and a lot of great ideas and a lot of passionate and very eloquent folks letting us know their views, which will certainly make it into everything that we are working on collaboratively with the Chamber and Diplomat and Davies. So over to you, Ryan.
Great. Well, I'll be super quick here. Eric, excellent job moderating this session. You did a great job sort of facilitating the discussion. I really appreciate everybody taking the time. The Canadian Chamber and the National Cannabis Working Group is an industry organization, and we spend a lot of time talking to industry voices. And I really appreciate, as Eric sort of voiced, the patient advocates and patient stories that you've joined and shared with us today as we consider the medical side of legalization in Canada. for both on medical and cannabis health products, you know, I'm sure we could have kept ourselves busy here for another hour. I would highly encourage you, if you had something you wanted to share and didn't get a chance to, you can fill out our survey. There's a link to it in the chat. Christy's going to pop it back in there again. There's some open forum to share, just agree with anything you've heard here. Or you could send us some comments or a brief to cannabis@chamber.ca. Especially for the cannabis health products, we didn't get to spend as much time talking about these in this session. So anything that you share with us through the survey or directly through email will be treated just the same as any comments made here during this last 90-minute discussion, and that'll go into the process for us. So thank you again, everyone, for taking the time. We've got more of these lined up as we continue our consults. If you're a company that's interested in getting more involved in this work, not just through these public consultations, but for the working group as a large, please email us at that cannabis@chamber.ca address, and we'd be pleased to include you. And thanks again for your time. Thanks again, Eric, and I look forward to talking to everybody again soon.